Good afternoon. My name is Tom Vogt, and I would like to draw your attention, before we get into this, to the two quotes on this screen. The first from the premier editor of the nation's leading scientific journal, calling our health system a more embarrassing disaster each year. The second from the White House, proposing new initiatives for the world's best healthcare system. I want you to ponder that contradiction as we go through this. I first got interested in healthcare issues as a Peace Corps volunteer after college in Eritrea and Ethiopia. As a part of that experience, I was invited to go on a smallpox vaccinating expedition to northwestern Eritrea, where we vaccinated desert nomads. That's me doing my very first medical procedure that I ever did in my life. The interesting thing is that smallpox vaccination was invented in the 1790s by Jenner. It took almost 200 years for us to learn how to use that vaccine effectively so that we could eliminate smallpox from the world, and we did so 12 years after that picture was taken. The World Health Organization announced smallpox was a thing of the past. We need to learn that lesson for our healthcare system. So let's get into that. The United States is the only developed nation on the planet that does not have universal health care. We rank last among those nations in life expectancy, last in infant mortality, last in patient satisfaction, and we spend twice as much as any other nation on health care, or approximately, on average, twice as much, but more than any other nation. The irony is that we have the world's finest medical care technology. And yes, you can get wonderful care in this country, but good luck accessing it. After 30 years of debate, why are the majority of Americans not aware of those easily verifiable statistics? We'll get into that. It raises three important questions. What are other nations doing that we are not doing? What are we doing that they aren't doing? And if we learn from other nations that have successfully reformed healthcare systems, what can we accomplish? That's what we're talking about today. So first of all, what's wrong with US healthcare? I love this metaphorical slide. It pretty much gets one of the problems straight. I was going down Wilshire Boulevard in Los Angeles at rush hour as a passenger, fortunately, so I could take the picture. And there were two road crews. One planted one of those signs, one planted the other one. They had no communication, and the whole street was totally frozen for a couple of hours. So that tells you one of the problems, and I don't have to explain that one anymore. In 1960, ignore the little boxes on this graph up there because they're not relevant to what I'm talking about here. In 1960, the left side of that screen, we spent 5% of our healthcare budget, 5% of our GDP, gross domestic product, on healthcare. And we ranked higher in the world than we do now in terms of all of those statistics I gave you before. In 1917, we spend 17.5% of our GDP. And our own government, and that's far more than any other country, our own government forecasts that by 2025, our healthcare costs will increase another 73%. And by 2045, our healthcare costs, unless we do something drastic, will exceed our entire gross domestic product, which of course is impossible, but economic collapse isn't. So what is wrong? Why is our system so costly and so inefficient? There are a lot of reasons for it. I've picked out what I think are the 5 most important ones. They're not the only ones, but these are the biggies. No other country in the world has more than 10 entities paying the bills for healthcare. The US has over 1,000 payers, including governments, industries, agencies, private insurance companies, and so on, and over 3,000 health plans. It has been calculated that if we simply did nothing else but copied the single-payer system of Canada, that it would save $300 billion a year because of the legal and administrative morass of arguments over who's responsible for what in our company. As you'll see, I don't think a single-payer system is essential because there are countries that have a few payers, and they do just as well. But 1,000, 3,000 health plans doesn't work. Secondly, we have a lot of ridiculous, stupid laws passed by Congress and lobbyists who help them get elected and stay elected. The US government is the only entity on the planet that is not allowed by law to negotiate drug prices when they buy drugs from companies that make them in New Jersey. When New Jersey sells those drugs to Russia or China or socialist countries, communist countries that we think of as having closed economies, they negotiate prices. And they end up paying about 1/4 to 1/5 of what we pay in this country because they're not allowed to negotiate. The US government is also one of only 2 nations in the world that allows prescription drug advertising to patients. Or not to doctors. A lot of people could advertise, but not to patients. That cost $5 billion in 2015, which is also added to our drug prices. And to top that off, they said, oh, you can't cross the border and bring drugs in from elsewhere. That's also illegal. We have great health research, but we don't pay any attention to, or very little attention to cost and to mechanisms of delivery. We have no free market. In this bastion of capitalism, it's against the law for hospitals to tell you what they charge. And a little clandestine survey done a couple years ago in California showed that a simple, uncomplicated cesarean section across several dozen hospitals ranged in price from $5,000 to $88,000. And you can't find that out. It's like you go into the mall and you want a TV set, you think it's going to cost $800, and you say, how much is that TV set? And the clerk says, I don't know, but you just take it home, we'll send you a bill. So you take it home, and 2 weeks later, you get a bill for $16,000. As ridiculous as that sounds, it's exactly how our system works. We have no shared risk. The fact, as you'll see the numbers in a minute, every country not only has, in developed country, not only has universal health care, they pay less and have better outcomes. And finally, why don't our lawmakers address these problems? And the answer is clear. They don't address them because it costs so much to run an election, only the major corporate donors have enough money to get them reelected. And if they address this, they will not get reelected. And there are some actual examples of that. So what's happening next for US healthcare? We're at a fork in our road. This is one of the forks, and that's where it goes. We'll drown. Economically and health-wise as well. If we keep doing what we've been doing for 30 years, that is arguing and bickering about how to change our healthcare system without actually addressing the real problems that make it so inefficient and expensive, costs escalate, the economic collapse is likely, maybe even inevitable. Fewer people have insurance because the great American way is, oh, gee, when it gets expensive, we'll just throw people out of the system. No other country denies everybody health care, and they do it cheaper. Medical bankruptcies will increase. We are already the only country on the planet where medical bankruptcy is the leading cause of bankruptcy, and social dissatisfaction is going to get a lot worse. What can we learn from other nations? These are the essential things that you should expect a rational, educated politician debating health care reform to address. Reduce the number of insurers dramatically, restore a free market, negotiate prices, public release of prices, compete on cost instead of on how many big machines and high-end specialists you have, ban prescription drug advertising. Universal coverage saves money. It does. Every other developed nation has it for less and better outcomes. Fund and publicize cost-effectiveness research. Your advertising to you convinces you with those gorgeous ads on television and smiling people that you should buy a drug that costs 50 to 60 times as much as a generic drug that nobody advertises anymore that may be at least as effective and sometimes even more effective. But we don't find out about that. Legislative Collaboration, cooperation, and compromise are essential. Politics is the art of compromise, and if there is none, you have a dysfunctional government as well. I made this table from a CIA World Factbook table, online table, and I calculated the green bars. They didn't have those numbers, but they gave all the numbers you needed to calculate them. This ranks 19 developed countries, Japan through the US, in order of life expectancy. Japan lives 4.5 years longer than the average American. And all of those countries have universal health care, except us. And they all cost less. The bars are the amount of money we would save in this country per person per year if we actually adopted entirely the health system of those countries. The average of all of them was about $5,000 a year. That's pretty dramatic. If we did that, depending on which of those countries we copied, we would save between $1 and $2.4 trillion a year. That's $3,250 a trillion dollars. It's $3,250 for every single person in the country. We could increase life expectancy, improve satisfaction, and ensure everyone, because all those other countries already have those things on that. And we could use the extra money to repair our infrastructure, balance the federal budget, reduce college tuitions, address global warming, or lots of other things. We have a problem, though. You could not simply reach in the pot and pick $1 trillion out of the healthcare industry and throw it somewhere else without causing financial, medical, and political chaos. So you have a model to help you figure out how to do it. In the 1980s, Taiwan had a very similar health system to our own. It was dysfunctional, cost soaring, and they acted with some intelligence. They appointed a team of experts to tour the world for several years, looking at what works around the world in health system. From that, they created a new system, and then they took another 4 or 5 years to implement it, gradually, a little bit at a time. Did it work? Within 5 years after their implementation, they fell from 50th in the world in life expectancy to 15th. Their patient satisfaction went from 25% to 85%, and their costs fell dramatically. It's not like we don't know how to do it. It's that we don't have the will to do it. Part of it is that we haven't talked about the underlying cause. In 1976, the Supreme Court decreed that money is free speech and that those with the most money can determine who wins elections. Since that time, the cost of getting elected to any political office has soared about tenfold. The only way you can get that kind of money is from big donors. And these are the big donors. The two biggest donor industries are healthcare and defense. That's where the money comes from, and that's where you just hear honest pronouncements from our politicians. This is not a Republican or Democrat issue. It is nonpartisan. It's true for both parties. 60 nations. I talked to you about the developed nations, but there are actually about 25 non-developed nations that have universal health care and do better. A soft landing with this problem of our healthcare system is possible if we do it right. Those are the countries that already have universal health care. Let me say a little word about what I mean by universal health care. That means everybody has some basic health care available to them, no exceptions, no exclusions for pre-existing conditions. That's true in all of these countries. The amount of benefit varies. Almost all countries have a mix of basic government-paid universal health systems and an option to buy additional coverage from what are often called insurance exchanges rather than companies, with very clear benefits and prices that are upfront and straightforward, and they choose which they want. We don't have that. If you hear a politician say the U.S., the nation or the world's richest economy cannot afford universal health care, that person is either woefully misinformed or he or she is deliberately misleading you. We have a serious problem. Our healthcare industry is threatening our economy. We talked about that smallpox way back then. 200 years it took to figure out how to use small vaccine to get rid of smallpox. We don't have to wait 200 years for healthcare to learn how to deliver it effectively because we got all these other countries that are already doing it. I'm not saying they don't have problems, but they have better outcomes and less expense by volumes than we have. It's time for us to figure out what we're doing wrong and fix it. What can you do? I say it's a tough nut, but you have to think about this. I don't care what party you're from. If a politician you can vote for is running for office and mentions health care and doesn't talk about those 5 basic problems that we went into, don't vote for him. And tell everybody why you're not voting for him. Tell your politician why you're not voting for him. If you will recall, John McCain ran on the platform in 2000 for president, on the platform of the biggest problem in this country is that 1976 Buckley versus Vallejo Supreme Court decision, and we have to change it. He never mentioned it after he lost that election. In 2008, he was interviewed by a reporter who asked him why he hadn't mentioned it again, and his response was, there are more important problems now. I can't pretend to know what was going on in his mind, but it makes me wonder. We have to act about this as if our lives and our economy depend on it, because they do.